S4 News. This is Facing South Florida with Jim DeFede.
Good morning and welcome to the coronavirus edition of Facing South Florida. Like many of you, I'm working from my home, where I've set up a little studio. But we are still going to give you those important interviews you've come to expect. This week, the governor finally taking action to order people to stay home. It comes weeks later than it should have, and as the death toll in the state rises, that decision will face increased scrutiny. In the meantime, the state is facing questions about whether or not it is prepared for what's about to come. On Friday, I spoke to Jared Moskowitz, the head of the state's Division of Emergency Management, about whether he is able to find the supplies that he needs.
On the PPE front, we're doing fine on gowns and gloves and booties, antibacterial, goggles, face shields, but these N95 masks are still a major problem. I mean, I've signed hundreds of millions of dollars of POs only to come out with air because these folks just can't deliver. Warehouses that are empty, flights that don't exist. And I understand, what 3M is saying that, well, we have to export so that we can import. Well, listen, I don't need an explanation on their business model. All we know is they're supposedly making tens of millions of masks a week, and they can't sell any to me. I mean, I literally had them on the phone and said, will you sell them to me directly? And the answer was, we don't have any ability to do that. Now, Jim, I don't know how many companies you know, but usually if you make a product and somebody has money to buy the product, it's a very simple, easy transaction. This is not, apparently. I have to go through their authorized distributors, which in a lot of cases are shipping this stuff out of the country, selling to the highest bidder. So it's the wild, wild west of medical sales. It's not just here in Florida. It's happening around the country. I hear the frustration from fellow emergency management directors that I've spoken to. We're having to turn to alternative products. And it's just it's a really sad situation because this is really about protecting those heroes that are on the front lines, those doctors, those nurses, those healthcare workers, the folks that are working in our hospitals, all their staff. I mean, the reason why I'm frustrated is I'm frustrated for them because the idea in the richest country in the world that we can't get a 68-cent mask to them is unacceptable.
So to go back to the issue of 3M, you've been trolling them on Twitter, trying to get a reaction from them or trying to get a conversation from them. It sounds as if that's worked. When did you actually speak to 3M? When did they begin addressing your concerns, over the phone and actually talk to you?
Oh, well, I spoke to them yesterday. I don't know they were addressing my concerns. I think they were trying to explain the facts of life to me, like how a bill becomes a law, like how a mask comes into existence. I didn't need a 10-minute dissertation on their manufacturing process, which is what they were trying to give me. I wanted to talk about the ability to buy a commodity. And I got the answer. The answer is they have no ability to sell them to me directly. And they've put out no guidance, no prohibitions to their authorized distributors on who they should prioritize, like our hospitals and our first responders. I mean, the idea that a U.S. company has made a business decision not to prioritize the folks at our hospitals, their first responders, the doctors, the nurses, the fact that was their business decision, and instead they want to export this stuff overseas. I mean, America's going to have to really look themselves in the face and figure out that some of these corporations and their business models are completely broken when it comes to these emergencies on this life, health, safety stuff. I mean, it's okay if we buy, the toys at Target and Walmart for our kids that are made in China. That's not a problem. But the idea that we have to rely on the world for ventilators, and we can't get ventilators here because we no longer make that stuff in America, that is causing a major supply chain issue. And I don't know how to tell doctors and nurses and hospital workers why we can't get them a 68-cent mask, why that's acceptable. It's not acceptable. And so, since obviously we've brought this to light, I know the president used the Production Act on 3M, and he's put out some tweets and some statements. I know the CEO of 3M was on CNBC defending, again, how the world economy works. Again, people don't want to hear an explanation of a white paper, right? They don't want a white paper on how the manufacturing of these masks work. What they want are the masks.
Let me try to break that down just a little bit. You said the president has used the Defense Production Act. As I understand that act, doesn't that essentially federalize that facility so that the United States government can then take control of the product being produced at that facility? Why is that not happening?
No, so Jim, I think that that step has been taken now. I think the federal government is going to step in and take a larger control. But that's only of the factories that are here. Let's be honest, right? A 68-cent mask, you and I both know most of the manufacturing of that mask is out of the country. Okay? And that's why it's 68 cents. It's because it's manufactured in countries all over the world. And those countries are not letting things be exported. Meanwhile, in the United States, we're exporting medical supplies because corporations, are worried about their shareholders and the bottom dollar. And I get that they should be worried about those things, except maybe when we're in a pandemic and we need to take care of our own country first. And so, I'm hoping the federal government uses every power, leverage, bully pulpit that they have in their pocket, so that we can try to get these masks as fast as possible to the front lines.
What is it that's out there that we haven't been talking about that is on your radar? Because again, as you said, you look at things not just today, tomorrow, you're looking at 30, 60 days out. What is it that is not part of the conversation right now, but you're afraid will be in the conversation very, very soon?
Hurricane season, right? Starts June 1st. It's around the corner. And the early predictions are predicting an above average season, somewhere between 14 to 18 named storms. And so I literally have a completely separate planning cell that we've created that is designing new plans, new evacuations, new shelters, and all of our policies around potentially having some limited COVID activity going on in the state of Florida during hurricane season. Obviously, no one believes we'll be where we are today in the July, August, September timeframe. But again, that's not how emergency management plans. We got to plan for the fact that, are we going to use schools? How are we going to shelter people? Are we going to decompress hospitals? What if I got people with COVID? Where do I decompress them to? Evacuations, same thing. Am I evacuating from hot zones if there still exist? Am I evacuating people into those hot zones? Those are the conversations that we're having that obviously is not, part of the day-to-day dialogue because it's far down the line. But, that is something that I'm thinking about. I'm worried.
I don't even want to think about the hurricane season, but I'm glad somebody is. The idea that this virus